We still have some time on the program to see what's happening in other news, starting with the plea by Nigeria's Minister of Health, Professor Onyebuchi to the Nigerian Medical Association not to go ahead with the association's proposed strike in July 2014. The NMA's demands include, among others, the immediate passage of the National Health Bill, appointment of a Surgeon General of the Federation, the payment of 100,000 naira hazard allowance for medical doctors, and the skipping of level 12 by medical and dental practitioners. Professor Chukwu says some of the issues are already being looked into.
They say they want to go on strike. Government says don't go on strike. National Assembly is doing well in terms of the help bill, and since the Senate has already passed it, the House of Rep has given us their word that it also be passed, but I can't speak on their behalf. And I don't think it's any reason for anybody to go on strike. I don't think so. Because if you go on strike, by the time the National Health Bill is passed, then who will you use it for? All the patients who have died.
Meanwhile, the striking resident doctors at the Lagos University Teaching Hospital, Idiaraba, have suspended their over 2 weeks industrial action. The suspension is based on intervention by the Ministry of Labour and Productivity and agreement signed by both parties after most of the issues have been resolved. Issues surrounding residency training, shortage of manpower, staff welfare, infrastructure, patient care and general work environment had forced the doctors to abandon their duties. Looking at Nigeria's healthcare delivery system, although the country's health sector has recorded appreciable progress in terms of expanded services, a lot more still needs to be done, especially in providing easy and affordable access to service for the people. At a public health colloquium to celebrate a professor of community health and primary care, Professor Oladipo Nkwo-Nuwusu, the Chief Medical Director of the Lagos University Teaching Hospital, Professor Akin Oshibogun, speaks on the areas that need improvement in Nigeria's health sector.
The area that we are working upon now is universal health coverage to ensure that more and more Nigerians have access to health services. And I look forward to a day when most Nigerians have some form of health insurance to guarantee them access to health services and to protect them against catastrophic expenditure for health. So I think that's the area we need to put a lot of more efforts.
In the comfort of his house.
In other news, an outfit involved in the production and sale of unauthorized herbal products in Lagos has been sealed off by the National Agency for Food and Drug Administration and Control, NAFDAC. At a media briefing in Lagos, the Director General of the agency, Dr. Paul Ohi, advised members of the public to beware of misleading and false treatment claim through spurious herbal products.
We moved in and arrested Professor Dayo Oyekole, the chief consultant. He's the chief consultant of Mose Bolatan Holistic Life Care International, number 11, Ire Akari Estate Road, Isolo, Lagos. Upon investigation, we found out that a few of the products, 4 out of 14, were listed by NAFDAC between 2005 to 2007, long ago. Since then, the listing of the products have not been renewed. 10 out of these products have no history of listing with NAFDAC at all. But if you see his list, and I will share this with you, every product, he has about how many of them there, each of them has a NAFDAC number next to it. Each of the products has a NAFDAC. So they are using the name of NAFDAC to dupe the masses. We have not given any herbal remedy full approval for NAFDAC, full NAFDAC approval that it can cure anything at all. What we do for herbal medicines is that because people are using them, we only test them, do toxicological studies to test them that they are not dangerous, they are not harmful, if taken at the doses prescribed. But we do not have capacity to test for efficacy.
To child health, experts caregivers and students from Psychiatric Hospital Yaba and West Africa College of Nursing are in this auditorium to deliberate on new ways of managing child and adolescent psychiatric-related illness in Nigeria. Aimed at updating and improving the skills and knowledge of practitioners, the workshop also highlights the unrecognized and silent symptoms of child and adolescent mental challenges.
There are many issues that bring about these disorders, such as economic challenge, unemployment, marital problems, poor medical attention, antisocial behavior, drug abuse, et al.
On the back of World Blood Donor Day, consistently inadequate blood in blood banks in Nigeria is a big issue, and the Association of Medical Laboratory Sciences of Nigeria wants solutions to some of the difficulty associated with access to safe blood when the occasion arises. The chairman of the association, Lagos State Chapter, Mr. Abiodun Hamzat, says at the moment there is no alternative to blood, so Nigerians should be willing to donate blood without compulsion.
The demand for blood transfusion in Nigeria has never been so high in the past 50 years, other than now. And it is critical. It is high time policymakers begin to make policy that affects the populace in Nigeria. The recent bomb blast is a case study right now. When the thing happened at Iyanya, the Speaker of the House of Reps had to go and donate, and a whole lot of ministers donated. And this blood were in serious short supply, which is not supposed to be so. There were so many uses of blood, apart from bomb blast events. There is a high incidence of elective surgery in Nigeria these days. And all these things, they require blood transfusion, and there's gross shortage. In civilized countries of the world, the developed countries of this world, they have been able to overcome that. But in Nigeria, it's still a challenge.
Know your genotype. That's the message coming from participants in this rally by the Federal Medical Center, Ebute Metta, Lagos. Marking the World Sickle Cell Day 2014, the rally is to sensitize the general public on the importance of knowing their genotype so as to reduce the impact and control the incidence of sickle cell disorder in Nigeria.
People should come and know their genotype so that the drug they will give to them will help them to boost their immune system in their body. That's why we are doing this awareness that people should come. Lagos should come. Nigeria should come to FMC. It's a free medical test.
Finally, good news as researchers from Oxford University say they've made a breakthrough in developing smart glasses fitted with a specially adapted 3D camera for people with severe loss of sight. The glasses enhance images of nearby people and objects on the lenses, providing a much clearer sense of surrounding. The headset is still substantial and connected by cable to a laptop in a backpack. But the researchers are confident that in time they can be made the size of normal glasses. Eventually, the researchers say they could be available for the cost of a mobile phone, making an initial batch of 100 sets later this year. The Royal National Institute of Blind People in the UK, which has followed the project closely, says the glasses could make a massive difference to the lives of people living with visual impairment. It's a wrap on the show for this week. Thank you for staying tuned to Health News. Keep it locked on Channels Television. I'm Jomi Otaigwe.